Welcome to Doctors of Duty by Way2News. Present panel members ni stage మీదకి రావాల్సిందిగా ఆహ్వానిస్తున్నాము. డాక్టర్ బి భాస్కర్ రావు గారు, డాక్టర్ మంజుల గారు, డాక్టర్ కేజే రెడ్డి గారు.
Thank you to all the doctors for showing me, sir, ma'am.
Honestly, if 90% of the people, they don't have any off duty.
Was there a moment for you where you felt alone, like how I asked, sir?
I think that is a part and parcel of everybody's life, feeling alone, because when you believe in something and others don't believe.
We used to feel very proud. We are privileged part of the society.
So now in front of everybody, I would say that I have primary dysautonomia with multi-organ dysfunction and I have multi-organ failures. So I have Addison's, I have recurrent pericarditis with effusion, I have autoimmune hepatitis, I have multiple fractures in my leg and my hand, except my brain. Nothing else works the way it has to, but nothing has stopped me.
ఖాళీ టైంలో మీరు ఏం చేస్తుంటారు?
What I do when I come home, sit with my wife, have coffee, and we'll start doing Sudoku.
నాకున్న హ్యాబిట్ ఈ సినిమాలు దొరక.
Movies.
Mostly 90% of the doctors, they don't know how to lead their life, even though whatever they say, except work.
Ladies and gentlemen, welcome to Doctors of Duty by Way2News. What is Way2News? 1,40,00,000 మంది తెలుగు రీడర్స్ ఇష్టపడే #1 న్యూస్ తెలుగు డైరీ. Today, our event partners, Incor Group, Varamahalakshmi Silks, Centro and Godown by Diageo. Incor 2006 లో ఇండియాలో రియల్ ఎస్టేట్ ని రీడిఫైన్ చేయాలనే విజన్ తో ఇన్కార్ మొదలైంది. రెసిడెన్షియల్, కమర్షియల్ ప్రాజెక్ట్ లో గ్యాప్ ని గుర్తించి హైదరాబాద్, బెంగళూరు, చెన్నైలో పెద్ద ఎత్తున క్వాలిటీ ప్రాజెక్టులు చేపట్టింది. రియల్ ఎస్టేట్ తో పాటు హెల్త్ కేర్, హాస్పిటాలిటీ, టెక్నాలజీలోకి విస్తరించిన సస్టైనబుల్ సొల్యూషన్స్ ఇవ్వాలనే కోర్ ఫిలాసఫీకి కట్టుబడి ఉంది. వరమహాలక్ష్మి సిల్క్స్, సాయి సిల్క్స్, కళామందిర్ లిమిటెడ్ కింద ప్రారంభమైన వరమహాలక్ష్మి సిల్క్స్ కాంచీపురం చీరకు కేర్ ఆఫ్ అడ్రస్ గా నిలుస్తోంది. ఈ బ్రాండ్ కథ కాంచీపురం పట్టు చీరల రిచ్ హెరిటేజ్, వీవర్స్ నుంచి డైరెక్ట్ సోర్సింగ్, ఎక్స్క్లూజివ్ ఎలిగెంట్ చీరలు క్రియేట్ చేయడం చుట్టూ తిరుగుతుంది. పెళ్లిళ్లు, పండుగలకు అథెంటిక్ హై క్వాలిటీ చీరలు అందించడమే వాళ్ళ లక్ష్యం. సెంట్రో షూస్ అండ్ మోర్ గా ఫుట్వేర్ లవర్స్ కి సుపరిచితమైన వి రిటైల్ 10 ఏళ్లలోనే సౌత్ ఇండియాలో అతిపెద్ద రీటైల్, డిస్ట్రిబ్యూషన్, ఫ్రాంచైజింగ్ కంపెనీల్లో ఒకటిగా నిలిచింది. కస్టమర్లు మెచ్చిన, వాళ్లకు నచ్చిన కంప్లీట్ ఫుట్వేర్ షాపింగ్ ఎక్స్పీరియన్స్ ఇవ్వడంలో సెంట్రో చాలా నమ్మకంగా ఉంటుంది. గోడౌన్ ఫ్రమ్ డియాజియో. ఈ రోజు ఈవెంట్ కి మన సెలబ్రేషన్ పార్ట్నర్ గా ఉన్న గోడౌన్, ద లగ్జరీ సింగిల్ మార్ట్ ఫ్రమ్ డియాజియో, క్రాఫ్టెడ్ విత్ కేర్ అండ్ రిచ్ ఇన్ క్యారెక్టర్. గోడౌన్ డాక్టర్స్ ను గౌరవించే ఈ ఈవెంట్ కి పర్ఫెక్ట్ గా సూట్ అవుతుంది. With great attitude, great company and a great whiskey. Doctors, thank you for joining us this evening. ఒకవేళ హైదరాబాద్ లో ఏదైనా హెల్త్ ఎమర్జెన్సీ వస్తే క్విక్ డెసిషన్స్ తీసుకునే స్టడీ హ్యాండ్స్ లో ధైర్యం ఉన్న టీం కావాలంటే వీరే ఆ డాక్టర్స్. ఇది కేవలం మెడికల్ టీం మాత్రమే కాదు, అవెంజర్స్ లెవెల్ డాక్టర్స్ టీం. కానీ ఈ నైట్ మేము మీ నుంచి ప్రోటోకాల్స్ లేదా పేషెంట్ ఫైల్స్ ఏం అడగట్లేదు. మీరు డాక్టర్ మాస్క్ తీసేసి సామాన్యుల, లీడర్ల, తమను తాము హీల్ చేసుకున్న హీలర్స్ లా మాట్లాడాలని కోరుకుంటున్నాం. ప్రతి ఆపరేషన్ కి సర్జన్ కావాలి, ప్రతి బ్రాండ్ ట్రాన్స్ఫర్మేషన్ కి అబ్బాస్ లాంటి వ్యక్తి కావాలి. Way2News ఏపీ అండ్ తెలంగాణ స్టేట్ హెడ్ గా అబ్బాస్ గ్రోత్, పార్ట్నర్షిప్స్ అండ్ ప్రెజెంటేషన్ ని డ్రైవ్ చేస్తున్నారు. 2 తెలుగు రాష్ట్రాల్లో Way2News ని హైపర్ లోకల్ పవర్ హౌస్ గా మార్చారు. ప్లీజ్ వెల్కమ్ మిస్టర్ అబ్బాస్ అలీ. సో ప్రెసెంట్ ప్యానల్ మెంబర్స్ ని స్టేజ్ మీదకి రావాల్సిందిగా ఆహ్వానిస్తున్నాము. ఫస్ట్ భాస్కర్ రావు గారు, సర్జికల్ బ్రిలియన్స్, ఎంటర్ప్రెన్యూరల్ కరేజ్ అండ్ ఏ పబ్లిక్ హెల్త్ కాన్సిక్వెన్స్. ఈ 3 కలిసి డాక్టర్ బి భాస్కర్ రావు. కిమ్స్ హాస్పిటల్స్ ఫౌండర్, సిఎండి అయిన డాక్టర్ భాస్కర్ రావు కేవలం పేరు మాత్రమే కాదు, ఒక మూమెంట్. 5 రాష్ట్రాల్లో అతిపెద్ద కార్పొరేట్ హాస్పిటల్ గ్రూప్ ను నిర్మించిన విజనరీ, 30,000+ లైఫ్ సేవింగ్ సర్జరీలు చేసిన కార్డియోథొరాసిక్ సర్జన్, ఆరోగ్యశ్రీ స్కీమ్ ఆర్కిటెక్ట్స్ లో ఒకరు. సో థ్యాంక్ యూ భాస్కర్ రావు గారు. నెక్స్ట్ మంజుల గారిని స్టేజ్ మీదకి రావాల్సిందిగా ఆహ్వానిస్తున్నాం. కొంతమంది డాక్టర్లు రూల్స్ ఫాలో చేస్తారు, కానీ డాక్టర్ మంజుల అనగాని మహిళల కోసం రూల్స్ రీరైట్ చేస్తారు. పద్మశ్రీ అవార్డీ డాక్టర్ మంజుల గారు. థ్యాంక్ యూ. కేజే రెడ్డి గారిని స్టేజ్ మీదకి రావాల్సిందిగా ఆహ్వానిస్తున్నాము. జాయింట్ రీప్లేస్మెంట్ సర్జరీ గురించి వరల్డ్ బెస్ట్ మాట్లాడుతున్నప్పుడు డాక్టర్ కేజే రెడ్డి గారి పేరు తప్పకుండా వినిపిస్తుంది.
Good evening, everyone. On behalf of Way2News, it's a privilege and honor to welcome all the medical fraternity, our esteemed panelists, Dr. Bhaskar Rao garu, Dr. Manjula garu, Dr. KJ Reddy garu, and our generous sponsors, Incor, Centro, then we have Godwine and Varamahalakshmi. Before we begin, I want to take a moment to express my heartfelt gratitude to the entire Way2News team who worked passionately behind the scenes to bring this event to life. Thank you for the tireless efforts in honoring our doctors in such a meaningful way. We are proud to be celebrating Doctors of Duty. It's an honor to stand before such an extraordinary gathering of healers, caregivers and heroes who are our doctors. Today, on Doctors' Day, we celebrate more than just a profession, a purpose and a lifetime of compassion. This year's theme, Behind the Mask, is both symbolic and powerful. It reminds us that while the world often sees a white coat, a stethoscope and a mask, there is so much more behind it. There's a human being resilient, empathetic and devoted who carries the weight of others' hopes, fears and lives. Behind the mask is the doctor who skips meals to be at the patient's bedside. Behind the mask is a physician who holds a trembling hand in ICU when family members cannot. Behind the mask is someone who fights uncertainty and yet shows up every single day with strength. Doctors have worn invisible masks, masks of calm under pressure or composure in crisis, of confidence when outcomes are unclear. But today we take a moment to look beyond those masks, to see the courage, its life and death decisions, the sacrifice of time, comfort and sometimes even personal health. The humanity that connects a doctor to a patient, not just as caregiver, but as a guide, a listener and a protector. Each one of you here today have touched countless lives. You have been the reason someone walked again, smiled again and breathed again. You have not just treated illness, you have restored dignity, given hope and reminded people that they matter. We have seen during COVID, you have worked through exhaustion, heartbreak and even fear, but you have never let your mask slip. You stood tall for us. So today, let us not just say thank you, let us honor the people behind the profession, the heart behind the science, the soul behind the skill and the human behind the mask. Let us celebrate the stories, sacrifice and silent victories. To every doctor here, thank you for choosing a life of purpose, for being the face of hope behind the mask. Happy Doctors of Duty. Thank you.
Now I request panel members for lamp lighting. Head of Brand and Content, Hyperlocal Content ni lead చేశారు and 50+ podcast ని several business founders తో చేసిన మిస్టర్ ఆదిత్య గుంటూరు గారిని స్టేజ్ మీదకి రావాల్సిందిగా ఆహ్వానిస్తున్నాము. థ్యాంక్ యూ ఆదిత్య. Thank you to all the doctors, Ochinandu sir, ma'am, all the three of you. Do you want to tell anybody anything that have come very late than you? You guys were the first to come, right? So they were here by 6:30 and waiting for you. So that's one to start off with. Done. As we said, today we're doing Doctors of Duty. Thank you for everybody for visiting us today, right? I don't know if we have to really call it off duty, because on a Saturday evening, we've asked all of you to come and talk about your professional lives
being a little bit personal about it, right? It's like telling your patients don't take any stress, then giving them a bill of 10,000 bucks, right? Okay, sir. So, like this year's theme, no ma'am, sir, and all of you, it's saying behind the mask, right? There is a life behind the mask for you personally, professionally, and all of that and all. But then, is there really a time where you are off duty, sir? KJ Reddy, let's start with you. Off duty, according to you, is what, sir?
Good evening. I think that's very important question we should ask everyone and ourselves. And I think a doctor's life as such, there is no off duty, to be honest, because even when you come home, there's so many things which is going through your mind. And I think very difficult to get off whatever happened during the entire day. But I think it is important that you come out of those thoughts and whatever incidents so that you can be ready for the next day. So everyone will have various ways of doing off duty. I'll tell you, I think my senior colleagues, Bhaskar Rao and what I do, I think initially when I was a little young, I'm not old, but a little young, I used to 24 hours probably, because coming from a background of PGI and UK, we used to walk around the clock. But now, for the past few years, what I do when I come home, sit with my wife, have coffee, and we'll start doing Sudoku. That will take your mind off completely. And of course, we spend about whatever difficulty is there, we'll spend some time together. And that's the best part of evening, and rather pre-evening. And I think it is important everyone will have some form of stress management. I strongly feel this is one way of my stress management. I think taking off some of the incidents, good or bad incidents, from your brain.
So, what is really off duty for you? You represent as a director off duty and a
Good evening, all of you. That's what I was saying, that off duty doctors, is it really there for anyone? Honestly, if 90% of the people, they don't have any off duty. They are 24/7. The one important thing, life is for enjoyment, but most of the people doesn't know what is the meaning for enjoyment. So that's why whenever we do, as long as you can work, you should enjoy what you want without any tension. Then there is nothing like off mask. Today, of all the people, the death rate is increasing in the medical profession because of many things. That is the reason we should always think what we are doing. One important thing, we are very, very resistant to change. So that change is not happening in the medical field. All in the medical field, last 4 or 5 decades, there is a lot of changes of the perception of the public, perception of government, perception of everybody. But we never changed. That is the biggest problem. We always, after comparisons and expectations, keep on comparing ourselves to with other people, the number, the volume, the work. Because of that, we are not able to enjoy and keep going on tensions. I keep on telling you, the patients keep coming and asking me, sir, tension. I'm asking, define what is tension. Tension is nothing but what you are doing. If you have a good knowledge about what you are doing, there is no tension. The tension starts what you are doing, what you have not achieved. So then you will end up in a lot of problems, then the tension starts. If you would have known everything, what you are doing, I don't think anybody will be able to have any tension. That's called enjoyment, what I feel personally. All these things are my personal thing. So what I want now, all of us, mostly 90% of the doctors, they don't know how to lead their life, even though whatever they say, except work, work, work. There are many methods that have been changed worldwide. We also need to follow. We know patients has come for us. We need to dedicate, commit to do everything for the patient. But at the same time, we should also take care of ourselves. The only way we should be able to follow is you need to be able to see whether we can be able to like-minded people join together in a group practice and then give good quality life, and at the same time you will be relieved of our pressure, work pressure, and you should be able to spend more time, whether you want to go for holidays, you want to spend in the home, you don't need to attend the calls, because when people are there, that's most of the people are doing now across the world. But second thing is the fear that comes when you go for a group practice. All of us will think what is going to happen to our finances. What we earn as a professional money is the peanuts when compared to the hard work we put in. That's why I realized about 2-3 decades back, then that is not the way. We should be able to do less professional income, more we should be able to enjoy by investing our own company. That will give maximum returns than what you earn on your profession. Like that, you should be able to evolve yourself, change yourself, understand the things rather than putting. That's why I always keep saying, I. The meaning for I is illness. The meaning for we is wellness. If you follow we, all of us should be able to be enjoyable and everybody will be very happy. Thank you.
Manjula ma'am, so what is off duty for you? మీరున్న దాంట్లో మీరు అసలు ఆఫ్ డ్యూటీ ఉన్నారా, ఉండగలరా?
Thank you, sir. Thank you. And good evening, everybody. Off duty, like sir, everybody told. Doctors, I think, this is one profession we never call off duty. Because especially in obstetrics, there's nothing called off duty. But luckily for obstetrics, there's been group practice from last so many years. So we do have. Now, every off duty under if you go into the next generation and especially the MNCs, they just work by 9 to 5. That's it. Saturday, Sunday, they do not work. So if you ask my daughter or anybody in the next, they only want to do less work, more money. They will just say one thing: I want a job which has less work and more money. Unfortunately, that is not the norm here. But again, unfortunately, for us, doctors do not know anything else except our profession. Very rarely you have people like sir who realizes that if you want money, it is different thing and business. But unfortunately, we were not trained like that in the medical field. And for us, our passion, profession is only like, we have been from childhood told that as a doctor, it is to heal patients. Not about money. Money will always come, but it is to heal patients. What I say when I say heal patient is, you are dealing with patients rather than the behind the back scenes like administration or anything. So even if today somebody says you administer and make other people, I cannot do, I will not be happy. Like sir said, happiness is the most important thing. So my WhatsApp thing is be happy. That is what is very important for us. But again, sir said, what is happiness is again individualized. For sir, it can be Sudoku. For sir, it is sitting whatever he wants to do. For me, de-stressing is the way to go forward, like sir said. But again, de-stressing is something which is individualized. I tell people, go gossip with people. That also is very, very de-stressing event. Why do we have to struggle and keep everything inside the thing? But saying that art of disassociation is something all of us should learn as a doctor. Disassociation, I mean to say that keep your stresses of hospital there. Don't take it home. Don't get the hospital stress into the work. That is very difficult to achieve, but if you do this part of it, most of your stress is compartmentalized and it will be better. But going forward, it is definitely the group practice which is going to make yourself off duty in the sense, but in the WhatsApp, you will have the group where any question will be put and you will have to own up your patient and you have to give answers. But saying that your personal life is very important and you have to love yourself. And for that, and I know of surgeons who go into the theatres morning before even sun comes out, and they come out after the sun goes. Their vitamin D is detrimental. They go to orthopedicians with all fractures and everything. So this is something people have to understand, that you need to love yourself and you need to give time to yourself, and wellness is definitely the way to go forward.
Now that we've heard all the three of them, right? We look at what is the human side of them, what is the leisure side of them, and what is the healer side of them, and how do basically they heal the healers as well, right? Let's start with Mr. Bhaskar Rao, sir. You're the leader of Hyderabad's largest medical institution. Okay. Introduction is పెడితే సామాన్యంగా ఎవరైనా ఒక అతన్ని మీరు ఒక ట్రైన్లో కలిస్తేనో లేకపోతే కలిస్తేనో ఎవరండి మీరు అని అడిగితే హౌ డు యూ వాంట్ టు ఇంట్రడ్యూస్ యువర్ సెల్ఫ్ టు దెమ్?
See, I always say that who you are means I say I'm Dr. Bhaskar Rao, I'm a cardiothoracic surgeon. Next step they will ask is where you work. Then I say KIMS hospital. That's it. There ends the matter. I don't even put my designation or anything. Many people who is our managing director, they are the CEO and all, they are there. Just there is no need of discussion on that point.
Right.
We basically a cardiothoracic surgeon.
That's it. Okay, understood, sir. So, ma'am, Manjula garu, pioneering work in women's healthcare. Okay, daniki meer very well known. There's a lot of following base and all of that happening and all, right? మీ గురించి తెలియని ఒక విషయము జనాలకి, ఎస్పెషల్లీ ప్రొఫెషనల్ పీపుల్కి, ఈ రూమ్లో ఉన్న ఆల్మోస్ట్ మీ కొలీగ్స్ అందరికి మీ గురించి తెలియని ఒక విషయం ఈ రోజు మీరు డిస్క్లోజ్ చేయాలంటే పర్సనల్ ఏం చెప్తారు?
I think now at this age, like at a younger age, we are always skeptical about telling anything about ourselves, especially the illness. So I always believe that never let your illness come in the way of your dreams, and you should never start treating yourself because of the fear that others, వేరే వాళ్ళకి మనం ఇలా రోగస్తులు మనం తెలిస్తే ఎట్లుంటుంది, ప్రాక్టీస్ ఎట్లా ఉంటుందో, పేషెంట్స్ వెళ్ళిపోతారేమో అని. So but no, in my case, right from 1993, I had multiple medical disorders which my team of doctors take care. In spite of that, everybody knows when the treatment, 6 doctors who are treating me know, but hospitals they know I go into ICUs and come out and everything. In spite of that, I never allowed anything to stop me and I continue doing it. So now in front of everybody, I would say that I have primary dysautonomia with multi-organ dysfunction, and I have Sjogren's, which is very active with multi-organ failures. So I have Addison's, I have recurrent pericarditis with effusion, I have autoimmune hepatitis, I have every organ, I have multiple fractures in my leg and my hand, and except my brain, nothing else works the way it has to. But nothing has stopped me in doing what I have to do. So this is something I have to do.
Is that something you know about ma'am before, by any chance?
Have you?
You okay?
One
Very
person,
good.
no, we also don't know.
My anesthetist also knows. My anesthetist knows it.
Right.
Because they are the people who always, whenever I operate, come out, I'm like this, they start giving me IV fluids and see that I resurrect for the next surgery. So they all know that.
Your story is most inspirational to your patients.
So, but
So
sir,
they know very well.
initially, sir, there were people who used to do hormones when I was sick. So I think I'm very lucky to have patients like
A lot of well wishers
Yes,
and everybody.
yes, thank you.
Right. So, KJ Reddy garu, the number of surgeries I think you wouldn't have kept account in Kodile Sundunta, right? Surgery అయిపోయిన తర్వాత, when you take off the mask, when you're coming out, what brings joy to you?
I think for most of the doctors, all of us, the real joy comes, all of us know, when patient attenders comes and tell you thank you. And what happened, most of our patients at this state, most of them are related, and most of the patients are related to our own patients. So they come and they tell, sir, you operated about 10 years ago, 15 years ago, very well, and he is one of the attendant of patients which are operated today. They come and tell, and we forgotten most of it. We remember some of them, but most of them we forget. So they come and tell us, thank you, sir, you operated a long time. And they tell their stories. What happens is, other day, I operated on a 102-year-old man with a fracture neck of femur. And they went around and took many opinions, whether to leave him like this or what is the risk. And I spoke to the attendants, I'm the patient. Some of the attendants were old patients. I told them that the risk of death on the table is significant. But the quality, if you take the risk, the quality of life that you can be on your own, you can go to the toilet, you can go to the bedroom on your own without support, you can sit on the dining table, and you can enjoy it with friends. That's a quality of life I can give, but you have to take the risk. And what you said, patient said, oh, I'm quite happy to take this. You lived 102 years means you can see how strong you could be. You might have seen most of the world. We operated. And it went very well, there wasn't any problem. So the next day when I went for rounds, my physiotherapist, I specifically asked, when I come back, make him walk. He was walking with a walker. And I think that makes us, most of us, makes us so happy. It's not the money, it's not anything else. The patient comes back and says, thank you. I'm here and this way because of you. I think that you can't describe in words. That's the biggest happiness.
So, you've spoken about the risk about the patient coming. What about the risk that you have taken in this case?
I have taken, but what happens is, that is important. I keep telling the patients, patients come and tell, sir, you're God. You saved so many people. I tell them, don't call me God because don't make us gods. We are only surgeons, doctors. We try our best to make you better quality of life. So I was concerned, but I knew it is, I think, because we have excellent team as a teamwork. I'm not one person. We have excellent cardiologists, physician, anesthetist, and my teammates. I'm not alone. We have people, team of 10 people. So I have confidence that I have treated people, similar people in the past. I was quite comfortable, but we can't be 100%. I told them there's nothing like 100%. I can't guarantee anything. There's a good chance. If he survives, the quality of life is much better than in the bed with bed sores, with so many other problems.
So, at times like this, when you put on your mask, do you tell anything to yourself when you're doing things like this?
Absolutely. I think what happens is, for every patient, we feel that it should go well. And as Bhaskar Rao said, I enjoy doing operation, whatever operation. And I love it. I do not do operations which will put me on stress. I only do operations which I enjoy. And we always say things, most of the time as a doctor, I think surgeons, we worry more about things around, whether everything will be available when I need it, rather than my performance. I know what level, because I know my limitations. I don't go beyond my limitations. But sometimes what happens is surroundings, like equipment, anesthesia, other things, we worry and we hope that everything will be as we expect.
That's such a lovely thing to say, doctor. Done. So, like you've seen here, there's a doctor, there's a healer, there's a pioneer, and all of them sitting over here, right? And they've been explaining how they feel and all of that. But let's go back to the theme that is there today with us, which is behind the mask. And going to that mask, putting that mask is the first ever dream that these people might have had, right? And all of you guys sitting over here also have the same dream that we should become doctors someday and all of that. Let's take them back to the day when the dream happened to them. Dr. Bhaskar Rao garu. Oath తీసుకున్నప్పుడు, the pledge తీసుకున్నప్పుడు, మీరు ఎక్సైటెడ్గా ఉండి మీకు చెప్పుకున్న మాటలు లేకపోతే మీరు ఆ రోజు మీకు అనిపించింది ఏదైనా ఉందా, మీకు మనం డిస్క్రైబ్ చేయగలరా?
ఓత్ తీసుకునే దానికన్నా ప్రొఫెషన్లో చేరకముందే మనం ఓత్ తీసుకున్నాం. ఇది ఈజ్ ఎ ఫార్మాలిటీ, ఓత్ అనేది డిగ్రీ వచ్చింది.
Right.
But when we join, before you joining into the medicine itself, we have that interest. You want to do something to the patient and quality, society in turn. So when we are keep doing during the medicine itself, when you have that interest, you learn in that way. When you have that ambition of being a good doctor to the patient and all. So when you are taking a oath, that's a routine thing which goes on. Which is not that just because I have taken an oath from that day onwards I need to do that. Oath is because we are giving a degree, that is a formality. So otherwise from day one we have been come to this profession to do something, to achieve something. That's what something has been inspired us. That's why we came in that. We sustain we lived up to our expectations, what we felt before entering into medicine, and we enjoyed the entire profession.
Thank you, doctor. Done. Manjula Garu. Do you remember the day when you've taken the oath? Do you had dreams in your mind or like with the butterflies in your stomach or anything like that?
Actually, no, I really don't know because Mark eppudilla oath ceremony avane like so there's
Okay,
nothing like
right.
this thing. I don't know how many actually took that Hippocratic oath. But then when I went as one of the in Siddhartha Medical College when I was as a chief guest for their students for that, they did the oath and then that's when I actually did the oath. In Gandhi and all when we were there, we did not have this oath. But saying that, I think like sir said, I ask the next generation when they come to me and ask they want to do medicine or not. I say, you want to do it because of the aura of being a doctor, or because you're doctor's son and daughter, so you want to do, or you want the white apron. It's not the mask. You will not remember the mask at that age. It is more of the apron which we want to show off rather than anything. So we really have to understand because you like doing something, you're doing it, or because somebody wants you, because you're the first ranker, so you have to do medicine, so you are doing it. I think there are so many questions which that today's generation to ask because the number of fields you have in today's time, it was never there for us. Till my time also, it was only medicine or engineering. At the most, some woman would go into teaching. Okay? But otherwise, it was only these two fields which were there for up till our times. But now, name it. What is it? Every field, everybody does so well. You take, I think that, who is that? Habib Javed or whatever it is, they make more money than any doctor can do, actually. So I think if you're doing your job best, that is what we should be looking at. You love your profession and do it, that is the way to do. So I think students now should think of more about what they want to do, understand their innate ability rather than getting an acquired ability because they are pushed into that.
Right, understood, doctor. Dr. KJ Reddy garu, do you remember the day you've taken the promise or the oath? Me life lo kuda undinda lekundinda?
అప్పుడు అంటే ఐ వాస్ ఉస్మానియా మెడికల్ కాలేజ్ దేర్ ఇస్ నో ఓత్ బట్ వాట్ ఐ కెన్ టెల్ యు లిటిల్ స్టోరీ నాట్ లిటిల్ ఇన్సిడెంట్ ఐ అంటే వీ కమ్ ఫ్రమ్ వెరీ low middle class family. My parents both are farmers. Very difficult, with great difficulty we studied. I'm the last one of 5 brothers, and I used to compete with my brothers, and we used to compete with each other. మేము చిన్నప్పుడు మా బ్రదర్స్ అందరికీ ఒకటే డ్రెస్ ఉండేది, చెప్పులు ఒకటే పైన ఉండేది. సో ఎవ్రీ దసరాకు మాకు న్యూ డ్రెస్ వచ్చేది. సో అవన్నీ కష్టపడుతుంటే వీ యూస్ టు కంపీట్ విత్ ఈచ్ అదర్. నేను రెసిడెన్షియల్ స్కూల్ సర్వేలో చదివాను, తర్వాత సాగర్లో చదివాను, స్టేట్ ర్యాంక్ హోల్డర్స్. అండ్ మాది ఫస్ట్ ఎంసెట్ బ్యాచ్ 1980 ఫస్ట్ బ్యాచ్. ఎంట్రన్స్ రాశాను, అంటే చాలా అంటే కష్టపడి రావాలి, సీట్ రావాలి. అండ్ వన్ మోర్ ఇన్స్పిరేషన్, మై ఫాదర్ డైడ్ 1 year బిఫోర్ ఐ గాట్ ఇంటు మెడిసిన్. మా ఫాదర్కు ఆస్తమా ఉండేది. సింపుల్ ట్రీట్మెంట్ నాట్ అవైలబుల్ బికాస్ ఇన్హలేషన్స్ అవన్నీ వీఆర్ అంటే నాట్ యాక్సెసబుల్ టు అస్. మేము అంటే ఫాదర్ విలేజ్లో ఉండేవాళ్ళు, హైదరాబాద్ తీసుకొచ్చినా కూడా ఆ విధంగా ఉండేది కాదు ట్రీట్మెంట్. అది మా ఫాదర్ ఎప్పుడు చెప్పేవాడు, నాకు ఇలా ఉంది కదా, నేను చనిపోయే ముందు నీవు డాక్టర్ అవుతావని చెవులో పడితే హ్యాపీగా చనిపోతాను. బట్ ఐ కుడ్ ఫాదర్ చనిపోయిన తర్వాత 1 year తర్వాత ఐ గోట్ ఎంసెట్. అండ్ ఎంసెట్ రాసిన తర్వాత ఉస్మానియాలో అప్పుడు కాలేజ్ ముందు డిస్ప్లే చేసి వాళ్ళ లిస్ట్. సో లిస్ట్ మా ఫ్రెండ్స్ అందరం కలిసి లిస్ట్ చూసాము. మై నేమ్ ఐ కుడ్ ఫైండ్ మై నేమ్. వెరీ ఓకే. అప్పుడు ఎలా అని ఫస్ట్ అటెంప్ట్ సెకండ్ అటెంప్ట్ ఉండేది, బయటకు వచ్చేసాను. అప్పుడు మా కొలీగ్స్ సరే కంగ్రాచులేషన్స్ రా, కంగ్రాచులేషన్ అని పరిగెత్తుకొని వచ్చాడు మా వాడు. అంటే చూసి నాకు సీట్ రాలంటే ఏంటి ఖరాబ్ తీసుకెళ్ళి లాక్కపోయి చూసాను. పైన చూడరా నెంబర్ 1 నీదేరా అంటే ఐ డింట్ లుక్ ఎట్ నెంబర్ 1 అండ్ లుక్ ఎవ్రీథింగ్ ఎక్సెప్ట్ ది టాపర్. I was the topper. I was very relieved, not excited, but very relieved that I got a seat and I going to become a doctor. But మా రోజుల్లో ఓత్ అనేది ఉండేది కాదు. కానీ జనరల్గా we were very inspired, అంటే very we used to very proud. అంటే నేను దిల్సునగర్లో ఉండి ఉస్మానియాకి వచ్చేవాళ్ళం. వైట్ కోట్ గురించి చెప్తా ఉంటాం. వైట్ కోట్ చేతిలో వేసుకొని వచ్చేవాళ్ళం. అండ్ ఎవరీ యూస్ టు రెస్పెక్ట్ డాక్టర్. వెహికల్ వెళ్ళినప్పుడు కూడా కోట్ వేసేసుకొని వెళ్ళే వాళ్ళము. the traffic police వాళ్ళు కూడా కొంచెం రెస్పెక్ట్ ఇచ్చే వాళ్ళు ఏమన్నా స్పీడ్ అది చేసిన రెస్పెక్ట్. సో వీ యూస్ టు ఫీల్ వెరీ ప్రౌడ్, వీఆర్ ప్రివిలేజ్డ్ పార్ట్ ఆఫ్ ది సొసైటీ అని. అండ్ ప్రాబబ్లీ ఐ థింక్ వీ షుడ్, దో సో మెనీ థింగ్స్ ఆర్ దేర్, బట్ ఈవెన్ నౌ ఐ థింక్ వీ షుడ్ ఫీల్ వీఆర్ ప్రివిలేజ్డ్. ఎక్కడ వెళ్ళినా కూడా డాక్టర్ అనే వరకు పీపుల్ విల్ హ్యావ్ డిఫరెంట్ ఒపీనియన్ ఆల్వేస్. కొంచెం దే విల్ హ్యావ్ ఆటోమేటిక్ స్పాంటేనియస్ రెస్పెక్ట్ అనేది ఉంటుంది. అండ్ దట్ వీ షుడ్ కీప్. Because I think I strongly believe we should be honest to the patient, and I strongly believe we should not criticize the doctor who has treated in the hospital. మాకు ఎలా ఉంటుందంటే ఆర్థోపెడిక్ సర్జరీలో చాలా మంది ఆపరేషన్ చేసి ఉంటారు, ఎక్స్రేస్ ఉంటాయి, వస్తారు. ఫస్ట్ క్వశ్చన్ అడుగుతారు, డాక్టర్ గారు ఇది కరెక్ట్ ఆపరేషన్ చేశారా లేదా అంటే నేను చెప్తాను, ఐ డోంట్ ఆన్సర్ దట్ అని చెప్తాను. ఏమంటానంటే, మీకు ఏ డాక్టరు ట్రీట్మెంట్ ఇచ్చినా కూడా మీకు బాగుపడాలని ఇచ్చాడు. నోబడి విల్ ట్రై టు హార్మ్ ఎనీ పేషెంట్. కానీ ఇప్పుడు మీ ప్రాబ్లం గురించి డిస్కస్ చేద్దాము. ఈ ప్రాబ్లం ఉంది, ఈ ట్రీట్మెంట్ అవైలబుల్, అండ్ నో పాయింట్ ఇన్ డిస్కసింగ్ అబౌట్ వాట్ హ్యాపెన్ ఇన్ ద పాస్ట్, బికాస్ అప్పుడు డాక్టరు మీ బెస్ట్ ఇంట్రెస్ట్తోనే తీశారు. అండ్ ఆల్ ది డాక్టర్స్, యువర్ కొలీగ్స్ కూడా, I think that's respect we should give to the colleagues. We should not criticize our colleagues in front of the patients, because that's a common cause for any medical legal issues. Bhaskar Rao because we run so many hospitals, and medical legal issues have become very big. Last week I got a notice from a judge. One ankylosing spondylitis lady. I wrote, she can have normal married life, she can have children. Ankylosing spondylitis without any symptoms, HLA-B27 positive, but no arthritis. I wrote that one, and the advocate sent me a letter, because your divorce process is going through. They showed the letter, and they sent me that one. So it's nowadays, because day by day going to increase more, so better I think we protect ourselves. That's very, very important. Do not say bad about any doctor who has treated, because we do not know what circumstances the doctor has treated that patient. But I don't think anybody would harm any patient if they come to them.
Can I just add one sentence to it? I think SOS today time will come to save ourselves. SOS has to be save ourselves first. So I think it is going to be very legal world in the next time. Nobody should trust the patient and think that they are not going to tell. So never trust anything. You do your work, justify that. They always will come up with asking that I came for second opinion. That doctor told so and so. I think, like Sir said, we should be very careful in what we answer.
Bhaskar Rao, so idealism to reality, అంటే సేవ చేయాలి, సొసైటీ, all of that treatment, దాని నుంచి వచ్చిన తర్వాత, when you started off, was there a moment in your journey when the white coat felt very heavier to you, or like hectic అవుతున్నది, stress ఉంది అన్నట్టు అనిపించిందా? Was there a moment?
ఇప్పుడు ఆ థాట్ రాలేదు, అది కూడా లేదు. ఎందుకంటే when we do surgeries, బేసిక్లీ ఇందాక నేను చెప్పినప్పుడు టెన్షన్, if you clearly explain to the patient what's going to happen, and you know yourself clearly whether you can able to handle this, not by taking any chance. Unless you have been proved, tested yourself that I can able to perform better, then only we should be able to take. And then if the same thing, if you able to convey very crystal clear, either you don't have any tension, nor the patient attendants, because they know each and everything beforehand, what's going to come, how it is going to happen. Even after success or failure, nobody will be able to feel bad. The only problem is most of us will take very casually, everything will go smooth. We'll say this. We don't explain first how this is going to be. The second important thing is what are the options that are available. If you say this is the only thing, then you also land up in problem. If you say you have these many options, this is the best option, the next is the second option. You should put everything in front of the patient and patient attendants. More than patient, we should be able to tell in front of the patient attendants. Because tomorrow something goes wrong, these are the people who are going to take our life. So like that, whenever we do, we enjoy it thoroughly, as far as the profession is concerned. The day when we thought that we can do much better when I go in entrepreneurship by providing many number of people job opportunities, and we can also create more places, quality healthcare. So that was also very successful when we've been planned very well in the beginning itself. And then most of the things are touchwood, all the 100% of the hospitals where we started doing very well in all aspects, quality of care, and the doctors are happy, employees are happy. So there is nothing I should felt bad that I should have been done some other profession, or I thoroughly enjoyed, even I'm enjoying the same.
So, ma'am, being a doctor is being everything to the person, right? Patient fabric especially. Going by your persona, how you're perceived by people, you're a doctor, you're a healer, and you become family to also many of the women and all. When did you realize that it's becoming too much of a stress factor, or it's becoming too much of a hectic thing to deal with?
That's true. Yesterday only one of my students is asking, when you do the surgery, when did you cross over from non-stress? Because now they watch me doing so many surgeries and different. They ask, when did you actually lose stress? Then I said, I don't know, fear is something which was never there in me, or stress was ever never there. Like Sir says, there's always a positive stress and negative stress. We all need positive stress so that we work well. Like any student going for exam, you need that positive stress so that you study well. But the negative stress is when it starts affecting your body. So that is something we should get over. And I don't know, luckily, unluckily, I never had. And I was very lucky in such a way that I'm 86 batch, sir. You're 80 batches, sir. So you must be in house since when I joined. But I'm from Gandhi. And by the time I was finishing my MD, my neighbors, everybody, they were waiting for me to finish my MD to perform surgeries. Now when I sit back and think, I used to be a tiny puny girl, I'm like, how did they have so much confidence in me? I would never be doing that now anymore. But I think that was what happened. But like you said, most of my close friends are all my patients who became my friends. And gynecologists especially becomes a part of their life because we become their friend right from 14th, 15th year of their life. They have anything until the menopause, we are with them. In fact, when we go to the schools and we give a lot of these awareness classes or many classes, we tell them that you should have two friends in your life. One is your mother and second is your gynecologist. Things you can talk to your mother, you can talk everything, but things you cannot talk to anybody. We have the professional ethics and we are not going to talk. So you come and talk to your gynecologist, everything starting from what are your doubts about anything to do with your health to any abuse which you can go through also. So we become quite close and they're very open with so many things before marriage, premarital counseling, pre-pregnancy counseling, everything they discuss, their fears. And sometimes before marriage when they come, they got their taboos and where they're going to have any vaginismus and all. We are very open in the way and like a sexual life or anything. So I think they are part of our lives and we are part of their lives. So that never becomes, but like Sir said, I will say everybody when they come to me, I put a diagnosis first, then I tell them, or any issues, need not be one diagnosis, it can be differential diagnosis. The next comes the options, 1, 2, 3, 4, and then we allow the patient to decide what option they want to take. So they can do, I always tell only one thing about these Google patients, don't do Google before. But come to the doctor, we put a diagnosis, go and do the research on that particular diagnosis. Don't go to the Google to get a diagnosis for headache. Headache can be because you spoke to somebody you don't like. Headache can be because you have not eaten well. It can be because you went out in hot sun, because you had vomiting. Or headache is because you're seeing some stupid movie or anything. But it will tell cancer and you're stuck to it. But when we say it is migraine, then go read about migraine. That is what I would suggest people to say.
Reddy sir, is there a gap between the doctor you wanted to become and the doctor you became?
No, I think I wasn't expecting to be like this. I think probably I feel sometimes I don't deserve the level I reached because what happens is various things. I think I wasn't expecting, not deserve, I wasn't expecting that I'll come up to this stage because my childhood was very deprived. So I think I'm very lucky, fortunate to be like this, and I think I've reached more than what my expectations was.
Understood, sir. Thank you. Right. Bhaskar Rao, you lead one of Hyderabad's largest medical institutes, right? Pandemic Kakunda, is there something that broke you really where you felt helpless and stood in the middle of Angel or Thangavatledu in a situation like that? Pandemic Kakunda, anything else that have made you stood in the middle of ఒక దీంట్లో ఎలా మీరు ఇరుక్కుపోయిన స్టక్ అయిపోయిన నాకు ఏం చేయాలో అర్థం కావట్లేదు అని ఇలాంటి సిచ్యువేషన్ మీ లైఫ్లో ఉందా వచ్చిందా ప్రొఫెషనల్
చాలా వచ్చాయి. ప్రొఫెషనల్లో ఏం లేదు. ప్రొఫెషన్లో బికాస్ వీ బీన్ ప్లాన్ వెరీ వెల్ అండ్ దెన్ విల్ గో అకార్డింగ్లీ మోస్ట్ ఆఫ్ ద టైమ్ బిఫోర్ we learn from in Australia that whatever we start, we sit with the nurses, we sit with the anesthetist, we will plan everything. Most of the times it will never go wrong. Only thing is after coming into the entrepreneurial journey, the governance, biggest risk is the governance. Whenever we want to follow, if you want to find out something, you can always find out something. So some of the times, especially when I want to go for IPO, I don't have something which license is bothering me. By the time it's collapsing the market, then I have to stop it. So mostly in the administrative things, because the administration is many people's involved, whereas the profession is only me and my team. My team is always I'm seeing, but the management, there are so many people whom I don't even actively involve. So there are some problems. Whoever made a mistake, that comes on us. Whereas in the profession, there is nothing like that. So that time, so the only thing is the entire thing, not that I have sailed smoothly. Every time we have a lot of problems. The success for anyone, for all of you, whether it is a profession, whether it is in the business or anywhere, any challenge you face, if you are able to tackle in a proper way, that gives you more and more success.
Done. Ma'am, breakthroughs in women care and everything is something that everybody knows and all, right? But was there a moment for you where you felt alone, like how I asked, sir?
I think that is a part and parcel of everybody's life, feeling alone, because when you believe in something and others don't believe, and then you really believe so you don't want to give it up, then you really feel alone. But I think people start developing thing where you start enjoying being alone rather than, it's not the loneliness, it's being alone. They are two different things. Once you understand the difference and you believe in something and you fight for it, everybody else will come. So like Max Planck said, I believe that I'm not here to say anybody is right or wrong, any procedure is right or wrong. But we think out of the box that we do know in textbooks, there is some solution. And we think for every patient we should apply that solution. It doesn't work like that. If a patient has a square problem, we need a square solution. Patient has a round problem, we need a round problem. Just because textbooks gives us a square solution, you cannot start putting it into every solution. So that's when we need to think out of the box and come up with a solution, which people might not agree. Because they have not been exposed to that, they say, how does it work? It doesn't work. Then we are not here to tell they're right or wrong. We are here to give a solution to the patient and go ahead, believe and do it. Over time, sometime, the next generation will come who are working with us, my fellows who work. For them, this becomes a norm. So next generation takes it forward where everybody do not accept, oh, was there a technique like that before? No, we think this is a norm. So I think there is that time always where we feel alone, but people will join and it becomes a complete group effort. Thank you.
Sir, if amongst all the surgeries that you've done, either of a surgery if you weren't satisfied or anything, there's a bad weight that you're coming out of the operation theatre. A bad weight ni etla deal chestaru? Do you leave it there or do you carry it home, or how does it work?
Generally, I think what happens is I don't plan a surgery where beforehand I know that it's going to be bad. But sometimes it happens. What happens is we plan something and once we go inside, we come up with some surprises. In orthopedics, it's very less likely because generally in the past we used to say people with a low IQ go to orthopedics because we don't need brains to do orthopedic surgeries. But there are challenges, especially with demanding patients with high expectations and so much of what happened, information available. So patients, most of our patients would know what they want, and sometimes they come and tell, do this one, I want robotic surgery of this company, whatever. So sometimes what happens is, because unexpected things, what happened during operation, something is broken because we did not expect bone is too strong, and we break it, we repair it, and as a surgeon, complications do happen, but it's important to recognize complication during operation on the table, rectify. It's very, very important. Identify during operation, rectify. Very unusual, I think, to have that complication recognized later on. So I think complications do happen. Everybody gets complications, but it is important to recognize, accept, explain to the patient that is what happened, rather than somebody else telling the patient. You go to the patient and tell them this is what happened and rectify. You can tell them that intraoperatively this has happened, we did this one, you're going to be all right, reassuring way. If it happens, you recognize post-operating, also you tell them. Yeah, but most of the time we should not leave it too long. If something happens, you rectify immediately, take the patient into confidence, relatives in confidence, treat them properly.
Thank you, doctor. So, Bhaskar Rao, healing the healers, which is widely on the internet right now, right? మీరు ఓకే స్ట్రెస్ తీసుకోరు, యూ కెన్ డీల్ విత్ ఇట్ అండ్ ఆల్, బట్ ఒకవేళ కానీ మీ టీమ్ బర్న్అవుట్ అవుతున్నది అంటే వాళ్ళకి ఏం చేస్తారు మీరు? వాట్ ఈస్ ద ప్రోటోకాల్ దట్ యు అప్లై టు దెమ్?
See, basically, as far as the profession is concerned, we know how much our team can able to work, especially in a cardiac surgery. Sometimes, lot of the sick patients, we know the patient is sick, and it may take longer time than what usually, and also in the post-op also it takes long time. That we will prepare them in the before the operation itself, and then we start the operation a little early, so that the people will be cautious rather than starting the late. Even if it is get delayed, then we will also ask them to take some turns, rather than, because we have so many team people, like even the nursing, the assistant doctors, ourselves. We have, being a surgeon, we keep enjoying it. We never go and take any rest or anything. We never able to exhaust. So we always see the outcome of it. So like that, we should able to take care when it is prolonged, and arrange with the lunch or dinner and everything at the same time. So unless you don't take care of them, everybody will have to see the main person. You enjoys everything, whatever is the outcome. But the surrounding people may not enjoy as much as the surgeon. So we need to take care of them very well. That's why we should be able to take care. With that, they will come back and work more enthusiastically, so the patient outcome will be better.
మ్యామ్, మీ ప్రొఫెషన్లో మీరు ఉన్న దీంట్లో డిఫరెంట్ టైప్స్ ఆఫ్ హీలింగ్ చూసుంటుంటారు, రైట్? But being especially women and the women doctors, what's the type of healing that you feel is required in the ecosystem overall?
I feel a girl is a girl's best friend, and they should have a girl gang where they can bitch, gossip, everything. They say women gossip more, but no. I have seen men gossip more, and they spread more rumors than any woman can actually do over the peg, over evening. Next day I'm like, okay, these are things which goes on. But I think women are people who should be doing it and went out everything what they can do about that. And fortunately, again, family is something where woman is always told to that. So evening after 5, when they stop, if they stop work and go back, I think that itself is a de-stressing. But we don't know, again, the stress can be at home also. So we just have to leave it there.
Got it. Sir, healing according to you is what? What can heal you? And institutional support or anything, can anything really, really help you at all?
Yeah, I think institution is very, very important, because we are part of the institution. Anybody feels that they are above the institution, I think they are not mistaken. Institution is important to support the team, and we can do wonders if institutional support is there. And you said healing the, missed that one, healing the healers. So it's important that I keep telling most of students, because I'm one of the promoters of SVS Medical College. There's so many, nearly 4,000 students are there. Every time I tell them, most important thing in your life is your own health. Because most of the time they don't look after their health and they get carried away so many things. So very, very important that you look after your health, especially the mental health. And what happens in institution with so many people, there's so many psychological problems. So we make sure everybody is assessed psychologically and they take some help. So everybody encouraged to take help, because there's a taboo that if you go to psychiatrist, there is something wrong with you, but I think that's not true. They should be open, they should have access. Otherwise what happens is in medical colleges, there's so many suicides, attempted suicide, some people keep hearing in the news. So it's very, very important that they come out their problems, as she said, or Manjula said, and mental health is more important than physical health. So they should look after both mental and physical health.
Sir, before we close, Okvela, healers need healing anedi undi, right? But then how it needs to be done, and me and Nunchi, to all your colleagues who were sitting this evening, what would you say?
So healing anedi, that's what I keep on saying. When you understand what you are doing, I'll tell you in a better way. When I joined in medicine, after that I want to become a cardiac surgeon. Before becoming a cardiac surgeon, I worked in 4 specialties, 3 months, to select which profession I want to continue. Then I decided to cardiac surgery. Then I came back and told my friends, family, everybody. No one has agreed and scolded like anything, because there was nothing at that time cardiac surgery except 1 or 2 places. And everybody thinks it's a big teamwork and all. I went ahead and did it. And then when we keep doing what I want to expect to learn, and I was in CMC Vellore, somebody come and says in the last minute, one Christian person, I won't give a seat to you because Christian has come. In no second, without any decision, I resigned there and came. When I came to Apollo, Dr. Girinar, he said, I was working, one of senior person came who was working with him in railway hospitals, then he has to give to him. Then I left there. I came to Nizam's. Nizam's, he promised, then I want to develop cardiac surgery. We were doing, many people have been fought with me. Then I also resigned in no time. Came to Medwin, then I went to Australia, learned everything. Came to Medwin. Medwin also was not cooperating with me. I resigned without any, not even thinking a minute. The entire thing, all these things is behind. When I joined in cardiac surgery, I have 2 people in my mind. One is Dr. Denton Cooley in Houston, and then Debeki. These are the 2 people who work together in one hospital, fought each other, built 2 towers. Everybody is doing about 20 surgeries every day at that time. Used to go a lot of patients from Hyderabad to Denton Cooley. Everybody says only. So he was so famous. That's why I started. Then I want to become like that. Then I started my journey in cardiac surgery in Mahavir, where I thought I will do it for 45,000 rupees so that I will also get the same number. Because of the selection of the hospital and all, we don't. Then I realized which we are not able to reach to that. Then I converted into an entrepreneur so that I can able to do more. So what I am trying to tell here is, whenever something coming across, instead of sitting on that, rather failing or maybe feeling bad about it that I have not achieved, you keep changing your ambitions, your goals, the way which you want to do. Ultimately you need to be successful. That's why from a cardiac surgery which I want to do 20 surgeries a day, could not able to achieve, rather than repenting myself and looking on, only thinking of that, I converted myself as an entrepreneur. Then everything has been moving on smoothly.
No, but actually, sir, I thought I was the only person who keep changing hospitals, then nobody's business. But after listening to you, I said, okay, there's somebody else who changes hospitals like me. Final destination तो मिल गया सर को. अभी भी मैं change कर रही हूँ.
Manjula garu, so what is healing according to you and how should it be further?
No, I think everybody's told everything. Me, my motto is never compromise with happiness. So I change whenever anything circumstances are irritating, or even suffocating, I just move out. So toxicity is something which is there everywhere. But if it starts affecting us, just move out. We don't have to fight. We don't have to make it more murky. Move out and go to another place. As long as you have work and worth and patience, everybody will welcome you, and then you can go to another hospital. Hospital with gully, Hyderabad has gully mein so many hospitals. Sir has so many branches in Hyderabad. So definitely, if you have work and if you have definitely the surgical skills, I'm sure you can always go there. So I feel everybody has to believe in themselves. So again, if you come to my clinic, it is there. Be yourself, believe in yourself. So there are certain things I believe in. If you are yourself not trying to ape somebody else and you're good in what you're doing and you believe in yourself, that is the best healing for you. So be happy, never compromise with happiness.
Bhaskar Rao, last question before we close. Khali time lo meer em chestuntaru?
నాకున్న హ్యాబిట్స్ రెండే. ఒకటి సినిమాలు చూడటం. సినిమాలు కూడా చూసిన తర్వాత మా ఫ్యామిలీలో చాలామంది సినీ ఫీల్డ్లో ఉన్నారు. వాళ్ళు డిబేట్ చేస్తుంటారు, నేను వాళ్ళతో ఫైట్ చేస్తాను. సినిమాకి వెళ్ళేది ఎంజాయ్ చేసేదానికి, వాళ్ళు సరిగా చేశారా లేదా అవన్నీ మనకెందుకు. యాజ్ లాంగ్ యాజ్ 3 years యూ షుడ్ ఏబుల్ టు లాఫ్ అండ్ కమ్ అవుట్.
రైట్ సార్. కేసీ రెడ్డి గారు, ఫ్రీ టైంలో మీరేం చేస్తారు? వాట్ ఈస్ ఇట్ దట్ యూ డూ?
Yeah, I think that's interesting because everybody should develop their own hobby.
Right.
I play golf. Every 3 days in a week, I am in Hyderabad golf course about 5:30, and we have a golf group, early for morning golfers, and not many, 1 or 2 doctors, many various other professions, and we play about 9 holes, which will take 3 hours. So from 5:30 till 8:30, 3 days in a week.
Right.
And that's what I do. I enjoy. I forget everything. And golf is your mind game. And I think that's, if you're positive, it will happen. If you're going to pot the ball, it is going to pot, going to the hole. If you say, may not go, it won't go.
Right.
So it's a mind game. And golf is the only game where you hit a stationary ball. So you have time to think. Unlike tennis, cricket, you don't have time to think. So it's a mind game, and I feel it's very good for the mind.
Understood. Manjula garu, what do you do, Khali time?
Movies, music, reading books, sometimes painting.
Okay.
That is what we do. But music is my life. I know I love. So tabla rasas and all those live music shows, I go. That's it.
Got it. Understood. So we'll conclude here, ma'am, sir, and sir. You've told us many things that people might have probably know about you or do not really know about you and all, right? But end of the day, when it comes to healing, it is very necessary and adivokati. Be happy, the very first thing that you're trying to assess on. Second, okal nachaledu ante quit there and move out from all of that. So that's what the panel is all about today, and that's what they had to say in all of that.
Thank you very much.
Thank you all, and yes.
This entire program more useful for every one of us, not only the speakers and all of you, and we also learn something with this. Thank you.
Thank you very much.